Hey everybody, it's Dr. Gaffney from Dr. Gaffney Best Foot. Thanks for joining me today. If you're suffering from arthritic feet, or if you're stiff and sore in the morning, aching throughout the day, or there's achiness that keeps you awake at night, I'm going to share 8 strategies that have helped my patients over the years. And some of them are simple that you can do today, and then we'll progress through to more sophisticated treatments. And at the end, we're going to talk about exciting research that might just be disease modifying. So stick with me and we'll get into the episode.
Full disclaimer is in the description. This is not a doctor-patient relationship.
Thanks for joining me. Okay, so we're going to discuss osteoarthritis in the feet. We're just focusing on osteoarthritis, not the autoimmune arthritis, which is psoriatic and rheumatoid. And those are horrible in of themselves because it's your body attacking your own joints. But these tips also can apply to autoimmune type of arthritis as well. And just as an unfortunate, sad reminder, osteoarthritis at the present time, it's not curable. There's no disease-modifying treatments, unfortunately, but there are many, many, many helpful treatments, and they help you to manage your osteoarthritis and help to lower your pain, increase your function. So we will go over that. The main goal here with the treatment strategies is to get your body into the healing type mode and lower inflammation. And you'll understand as we go through the different strategies. So what exactly is osteoarthritis? So it's basically wear and tear that has accumulated in the joint. And the joint with arthritis, all the parts of the joint get infected. So the cartilage, the synovium, the bone underneath the cartilage, and the ligaments. So the cartilage is that nice white cap on the end of the bone that meets the other bone, which also has a nice white cap of cartilage. And it's designed to just glide real smooth. And over time, gradually have a wearing down of the joints. And you can see that on x-ray with decreased joint space as the cartilage starts to get thinner and thinner. Okay, so what are the causes of osteoarthritis? It's mainly overuse. So as you get older, there's wear and tear. The inflammation that's accumulated overwhelms your body's ability to heal it. So the cartilage starts to break down. It involves the inflammation in the synovial lining, and the joint itself changes. So any trauma to the joint in the past, so either like a fracture or even surgery close to the joint, that can set it off. If you've had an infection in the joint, you can get arthritis after that. And also lastly, and gouty attack can set off inflammation that turns into arthritis. All right, our first strategy to help increase function, decrease pain in the feet in my patients is difficult, but it's simple and powerful, and that's diet and exercise. So the standard American diet kind of forces everybody into an inflammatory mode, a mode that isn't healing, and it's very difficult to break out of because it's processed food, it's seed oils, it's added sugars, and those all ramp up inflammation and just cause all kinds of problems, not just with your joint, but cardiovascular, brain health. So, and the processed food is designed to be addictive, which makes it so hard to break out of. So that's why I think it's important to join different groups, maybe get with a functional medicine provider. You can get with a health coach, and there's more and more health coaches out there to help people change out of that inflammatory lifestyle into a more healing and wellness lifestyle. That is the foundation. The diet is a foundation for wellness, and it really gets that inflammation out of your body, lets it have an opportunity to heal. So the other piece of the lifestyle strategy is the exercise. In general, just keeping moving is very important for arthritic joints so they don't stiffen up and get worse. If you have trouble walking with arthritic feet, or if it's just kind of early on and mild, just keep moving with the weight-bearing exercise. But if that's a little bit too much, you can switch to swimming or biking just to keep moving. And I'm going to share also a tip for exercise for the feet. Now, there's 4 layers of muscle on the bottom of the foot. So anytime you build muscle around joints, it takes the stress off of the joint. So that's very important. And I'm going to show you here how to do different exercise to build up your muscle in the arch.
This towel crunching exercise is really good to build intrinsics as well as this ankle rolling. If this type of exercise, moving your foot in and out, and also trying to spread your toes at the same time, which I cannot do here, will help build up the intrinsics. So if you do this about 5 minutes a day, it'll build up those muscles in the arch of your foot. Yoga also can do the same thing. And here's another view, getting better at spreading the toes there.
All right, so our second strategy, shoes and orthotics. So they're very important. The shoes, when you have arthritis in your feet, a lot of times it's in the midfoot. That's a common place for it. And also the big toe joint. So you need help pushing off. So there are Brooks, Hoka's, Ultras are all very good at that. If you get like a cross trainer running shoe, they usually have like a rocker sole that helps you push off. And that would just kind of take stress off of those joints and make it easier for you to walk and give you more function. I'm going to show you, though, a trick if you have like an arthritic knot on the top of your foot from a bone spur from the arthritis. Sometimes there's a lot of pain and pressure when you wear like a lace-up shoe that puts pressure on that area. I'm going to share a tip with you. It's real simple and it's very effective, though, to decrease pain in that area.
Here you can see I have a little arthritic knot on the top of my midfoot. It rubs in the shoes and sometimes hurts there. You can see how shoes are laced up right over that knot, and anytime you tighten them up, there's excess pressure on top of that knot and it causes pain. So here's a little trick that you can do. Just skip the eyelets right over top of that knot there where it's not going to cross over it, and go to the top eyelet there. The only thing with this is it doesn't pick up the tongue, and so the tongue can get a little floppy, but I've never had trouble with it. So then you just go to the top eyelet there and cross it on the top, just like that. And you get a nice little space for your bump. And here is with the foot inside the shoe, and there's the place for my little arthritic knot where it doesn't hurt.
All right, the other part of our strategy number 2 is orthotics. Now, orthotics for arthritic feet, you mainly have to go softer just to give yourself some gentle support of those arthritic joints. Especially orthotics are useful for midfoot arthritis. We use it for big toe joint arthritis too, and we put what's called like a Morton's extension to support that arthritic joint. You can get, if you have arthritis in your big toe joint, you can get a carbon fiber plate, and that goes underneath the insole. It's just like a stiff plate where it keeps your toe from bending, and that usually helps big toe joint arthritis. Okay, the third strategy is supplements, and I typically recommend to my patients fish oil, turmeric, or glucosamine chondroitin. There's studies showing that they may be equal to oral anti-inflammatory, and I'll link in the show notes the different studies that go into these 3 different supplements. I really like fish oil. It shifts the body from an inflammatory state to a less inflamed state. I personally take about 1.5 grams daily, and that helps my achy knees, and I basically don't have any achiness in my knees when I take that. But with fish oil, you have to discuss it with your doctor because it does have an anticoagulant effect, so it thins your blood and it can interact with your antidepressants. So you need to discuss it with your doctor. In fact, anything that you try related to any condition you have, you need to discuss it with your doctor to make sure it's okay. So fish oil is really, really helpful. That coupled with turmeric really boosts the anti-inflammation effect. So turmeric has a compound in it called curcumin, and that's the anti-inflammatory portion of it. And 2 supplements also help with brain health, cardiovascular health. Anything that reduces inflammation helps with brain health, cardiovascular health, joint health in general. And the last one is glucosamine chondroitin, and that just helps the health of the cartilage And I do want to add with supplements, you got to be very careful where you buy the supplements. So with supplements, they're not FDA regulated. So it's basically the wild, wild west out there when you try to find a supplement. So you need to find a reputable company. So reputable company is third party tested. So they test to make sure what the company says it's in the capsule is in the product, and also that they have good manufacturing practices. So they'll get a label that says GMP, and that means they're reputable. So the company that I trust is Pure Encapsulations. There's other really reputable companies out there. You just have to work with your physician to find the right one for you. All right, strategy number 4, topical medications. So the one I like to use a lot is Voltaren gel. It's also known as diclofenac. You can get it generic over the counter, which is great because it used to only be prescription. It works wonderful in the feet. I love it in the feet. It has a local effect. There's little to no side effects because it's just topical. When you take it by mouth, you can get GI side effects and that type of thing. But in the feet, it works great because there's very little fat in the foot and very little thick muscle for the medicine to penetrate through to get to the joint. So it's wonderful for the feet. And I usually cut the dose down because the dose on the tube is for knees. So I usually cut the dose down for the feet. There's also BioFreeze. I don't use that as much, but I've heard that it's helpful. BioFreeze also is over the counter now, and you can get it in most pharmacies. The other one I like to use a lot is compounding cream. So you need your podiatrist to write a prescription for this. So you can get multiple different medicines that a pharmacist compounds into a cream, and they put it with a base that can penetrate through the tissues, get into the joints. It's also very effective. They can put lidocaine in there too that numbs it. And the other one I like to use is just lidoderm patches. So if you're getting achiness at night, I would have my patients maybe cut a lidoderm patch in half, or just size it up a little bit and put it around that area. If it's in the midfoot, we'd put a strip on top and a strip on the bottom, just kind of circumferentially, and just wear it all night so you don't have the achiness. All right, with that, also I want to add with the Voltaren gel, you don't want to use it if you're allergic to anti-inflammatory medicine, and always check with your doctor before you use it. Okay, so our 5th strategy, non-steroidal anti-inflammatory drugs. They're prescription. I normally will use these very sparingly and for short periods of time because there's dangers associated with it. It can cause stomach ulcers. It can affect your kidneys. It can affect blood pressure if you take it over long periods of time. So I'll normally, if I have a patient that's struggling, maybe they went to Disney World or are on their feet a lot and they're having some arthritic pain, I'll stick them on a 2-week course of a COX-2 inhibitor. And the COX-2 inhibitors are a lot easier on your stomach, and they're great for joint pain. So those are Celebrex, Mobic, and Bextra. I like Mobic because it's once a day, 15 milligrams once a day, and you got to take it with food. And if you have high blood pressure, you should check with your primary care physician before you go on anti-inflammatories. There's some over the counter, and I'd be very wary of just going on anti-inflammatories over the counter. Please talk with your physician before you go on anti-inflammatories because there's a lot of dangers. You got to weigh the pros and cons. If you use them for judiciously for short periods of time, they should be okay in the right individual, but you got to work it out with your doctor. All right, the second one is cortisone injections. Now, cortisone injections act like magic. And again, you don't want to overuse these because they wear down the cartilage and the synovium over time. So if you have a bad episode where your arthritis is flared up, this is extremely useful. But I only like to give these once or twice a year, and normally not year after year after year, like 5 to 10 years, because even once or twice a year, you're going to get some wear of the joint. And our 6th strategy, modalities. So we have low-level laser in this category, and this is just basically small amounts of light energy that you have a low-level absorption without the heat into the tissues, and it helps to decrease inflammation, decreased degradation. It slows the loss of cartilage, improves stem cell differentiation, and stem cells are just your body's baseline cell that turns into functional cells later on. And it also decreases oxidative stress. Now, I've never had a laser or used it on one of my patients because lasers are very expensive, but certain practitioners have them out there, and they seem to be very useful. There has been some encouraging studies so far, but they're not robust. Also, physical therapy modalities like ultrasound, iontophoresis, phonophoresis, and they are anti-inflammatory. And also the therapist could help you with functional movement if you have more than one joint that's out of whack, and they can help you walk better, function better. All right, our seventh strategy, as we go on with the strategies, are more sophisticated, more complicated. So that's surgeries. It's something that nobody wants to go through, but sometimes you get to the point where all these previous strategies aren't helping anymore, and you can't get through your daily life, and it's a struggle. You can't do the things you want to do. You can't even go to the grocery store without it hurting. So that's the time we got to really think deep about going through a surgery. I know many people just don't want to go that route, but you'd be surprised how many people get their life back after they have an effective surgery. So you have to find a good foot surgeon and talk it over with them, talk over pros and cons about surgery. And mainly the surgeries that we do in the foot to help with arthritis are basically, like, sometimes it's simple where there's a bone spur that's rubbing and hurting. So those surgeries are easier to deal with. So you just have the spur taken off and you feel much better. So maybe that might work out, maybe not, but that's not going to help the joint pain if you have deep joint pain taken off the spur. So it has to be very specific pain. So pain associated with the bump from the spur for that surgery to work. The next one, we have joint replacements. Now in the foot, we primarily have it in the big toe, or if it's in the ankle replacement. The big toe implants work pretty well. Again, joint replacements only last about 10 years, but in the big toe joint, they kind of perfected it in modern times where it's very helpful. In the ankle joint, they're doing better at that implant as well. It used to always be a failed surgery, but in recent years, it's been shown to be effective. But the downside to that is you have to find a surgeon that does it all the time, and they're hard to find because the learning curve to putting in an ankle implant is very steep. And then lastly, we have bone fusions or joint fusions, and those work pretty well in the midfoot because the little joints in the midfoot, they're really tight. There's not much excursion of the joints, so they normally do okay if you fuse them. But anytime you fuse a joint, there's going to be changes. There's going to be more motion in the adjacent joints there. But most of the time with midfoot fusions, they tend to work out pretty well. We even do that for big toe joint arthritis, and that surprisingly works pretty well. And I did a big toe joint fusion on one of my patients, and he could run a lot better afterwards. So you can run after you get your big toe joint fused. All right, the eighth and most exciting strategy is regenerative medicine. Now, I don't have a whole lot of expertise in this realm, but it's exciting. The research is showing that's very promising. I have used one type of regenerative medicine, and that's the PRP, the platelet-rich plasma, and that's basically your blood spun down, and the plasma there has a lot of growth factors, a lot of healing type molecules, so that you re-inject into the joint and helps your joint heal. So we got PRP. There's also stem cells and peptides, and those just help your body heal itself and regenerate. And there's all kinds of regenerative medicine clinics popping up all over the place, and the research is building. So hopefully one day the FDA will approve all of these treatments. But right now there's not enough research to support the FDA approval, and therefore insurance doesn't cover it, which is sad. But one day I'm very hopeful that it will, and we'll have that type of modality to heal our joints and feel better and live better and thrive. And there's one final treatment that's in the works, and it's from a company called BioSplice. And this is very exciting because it's an injection, and right now it's in phase 3 trials. So now this injection of a molecule, it's been shown to increase cartilage thickness that you actually can see on imaging. So that is fantastic, to something that we can rebuild our cartilage. And we just hope and pray that it'll get through the phase 3 trials and it can be introduced into the market, and then we all can benefit from that. So that is just one hopeful thing I'm keeping my eye on, and I'll let you know any advancements in the future episodes. And thank you so much for watching. If you liked this episode and if this helps you, please hit the like button and please subscribe to my channel. I'd appreciate it very much. And we'll see you again next time. Hey, thanks so much for watching today. If you learned anything or if I've helped you at all, please like and subscribe to my channel, and please leave me comments and I'll answer any questions that you have. If you have any topics you'd like me to cover, please leave that in the comments as well, and I'll do an episode on that in the future. And thanks so much. We'll see you next time.